Today, I'll present the preliminary results of pediatric risk mapping in context of climate change. So here is the outline. I'll briefly go through the different metrics that we selected to create the pediatric vulnerability index and different methods that we used and how do they compare. And also give you a brief idea of the warming trends in the tri-state area that we have quantified during the last decade over 2012 to 2022. And also the location wherein all these three overlap that we define as the pediatric risk that is attributable to climate change. Here are 12 population vulnerability metrics that we adapted from the literature, as well as the fourth national climate assessment that have been highlighted as metrics that are increased vulnerability to climate change. A section of the population vulnerability metrics include percentage of children within different racial and ethnic minorities. We included non-Hispanic, Black, Hispanic, Asian, and Alaska and Pacific Islander. Also, children without health insurance, foreign-born children, children living in households below the federal poverty limit, households receiving federal assistance, and children living with unemployed caregivers, and children living with caregivers who have language barriers and with single parents, and also households who lack access to a vehicle. Also, we adapted, we have used the USDA ERS RUCA codes, the rural urban commuting area codes, to see which of the census tracts are either urban, rural, or different classes. And we have used 5 dimensionality reduction methods to build the pediatric vulnerability index. 4 of them are machine learning based, and 1 is a deep learning algorithm. You may be familiar with the PCA, wherein all the existing vulnerability indices are built on, and we thought we would also try the other methods that are available, which are TSNE, UMAP, exploratory factor analysis, and in the deep learning algorithm, we use autoencoders. So here is a spatial distribution of different metrics that we selected. And interesting to me is the unemployment pattern here is almost look like very small in most of the census tracts in the tri-state area, but we were able to see a lot of households that are receiving federal assistance, and also they are in poverty. And using all these 12 different metrics, we used principal component analysis first to see how they explain different factors that we included. So for the first PC, this derived variable is explaining about 24% variance of all the metrics that we included. And on the right-hand side is the loading variable, loading values for each variable that explains the PC1 or PC2. And for PC1, we were able to see like all these different metrics that we included are towards a similar direction, whereas in PC2, they are diverging in terms of the direction, how they explain. And here is a biplot using PC1 and PC2. We basically did this to see if there are any clustering across different census tract areas. And these arrow marks show the direction of how these metric explains PC1 or PC2, which are all towards the same direction for PC1 here. And here is a result from the TSNE algorithm. And for this algorithm, we were able to see different clusters, but there is a stress value of 0.8, which means there is a significant loss of information while transitioning from those original variables to the derived variable, which is the index that we are interested in. And here are the results from exploratory factor analysis. And it gave us an overall cutoff of 0.76, which means like I should be technically including only the variables with an individual measure of sampling adequacy above 0.76. But since we are interested to include all these different variables that we selected from the literature, as well as the fourth national climate assessment, we included all of them and tried to see like what happens. So even with the first factor, it explained 24% of the variance of the different variables that we included. And on the right-hand side, we could see how different factors that we derived from these 12 variables that we included, how much do they explain by each factor. So for example, factor one, it explains the best for the factors such as households in poverty and households without access to a vehicle. When we go to the second factor, it explains the best the language barriers as well as the Asian communities. And here is the deep learning method, wherein we used autoencoder, and here is the configuration and a biplot using index 1 and index 2 that we have built using the autoencoder. It showed like a really nice clustering, but we have the model performance comparison in the coming slides. So on the top, the pink section are the derived variables, and on the blue are the original variables. So we tried to see a Spearman correlation coefficient across different combinations. And I highlighted like 3 different derived variables, one using the PCA index 1, TSNE index 1, and exploratory factor analysis index 1 to see how they kind of correlate with our original variables. And here is a clustering of the 3 different indices that we created that are highly correlated with our original variables. And we could see that the PCA index 1 and exploratory factor analysis index 1 are highly correlated, like our value of 0.77. And we see that cluster in this corner. And I color coded using the RUCA codes of which of the census tracts are metropolitan, micropolitan, or small area or rural areas. And here is the same, but stratified by each state. And my initial assumption was to see in case if a particular category of census tracts would cluster towards one direction versus the other. Higher positive values means these are the census tract with high vulnerability. And using the 3 indices that are highly correlated with our original variables, I mapped those variables. The first one is the PCA based. The second is exploratory factor analysis based. And the third one is the TSNE based index. And we further explored using the index that is built using the principal component analysis, because that is the one that is highly correlated with our original variables. And here is how we kind of defined the neighbors for each census tract, assuming that each of the vertex should be in contact with the neighboring census tract. So each polygon could have 1 to many neighbors, and this is the architecture behind of how we defined each census tract would have a neighbor. And based on this, we created global and local autocorrelation for the PCA index. So for the global spatial autocorrelation, we used the Moran's I test, and it gave us a value of 0.24, and it could range from 0 to 1. 0 is very sparse and high is highly correlated, and we have a value about 0.24. And we did also look at local autocorrelation just using the PCA index of all the different vulnerability variables that we included. And we did see like very limited number of census tracts that are having a high combination, which means a highly vulnerable census tract have a high vulnerable neighbor. And going to the part with the hazard, which is climate change in this case, we have used data from NOAA, which is a 100-year historic normal for each month at a 4-kilometer resolution. And we used a data layer from NASA, from the MODIS sensor, which is the daytime land surface temperature over the meteorological summer months, and it is available at a 1-kilometer resolution. And the future climate change, we were going to use the NASA downscale projections at 1 kilometer for the future climate change for year 2030 to 2099, which is the difference between a high emission and a low emission scenario, which is still under the way. We don't have the results yet. So here is a layer of extreme heat, and we define this as frequency of days that are above the NOAA absolute threshold. For example, each 4 kilometer grid for the tri-state area, we have a normal value that was constructed using observations over 100 years, which is typically used for long-term climate change assessments. And for the study period, we have a 1 kilometer resolution temperature data set. So this map is showing for each 1 kilometer grid, how many days do we have that exceeded the historic normal for the tri-state area. And in this step, we look at bivariate mapping, which is using a combination of the pediatric vulnerability index and the extreme heat. So we wanted to look at this diagonal of combination between the extreme heat and the pediatric vulnerability. And our major interest was to look at this last quadrant, which is 75th to 100th percentile of vulnerability as well as the exposure. And to give more information, I kind of zoomed into this particular section, which is Philadelphia. So for Philadelphia at 1 kilometer section, this yellow dot is the city hall. And for each 1 kilometer, we have a metric that says which are the areas that have high vulnerability and also high exposure to temperature. And next steps is expanding on the future climate change layer and also releasing interactive bivariate map so that anyone who want to access, they could plug in their latitude and longitude to see if they fall into a certain combination. And also scaling it to the whole US area and publishing this work, obviously, and also expanding on external exposomes, such as using aerosol optical depth to define ambient air pollutants, wildfire prescribed burns, and precipitation, and also soil moisture to define drought. And acknowledgement, I would like to thank the Children's Center for funding this work, and also Ayman, who helped me and guided me giving feedback, and also Jonathan, who worked on this project.